This video is about the Francis Report and the 6 Cs. And why do you need to know about this? Well, the Francis Report was probably the biggest thing to happen in the NHS in many years, and it impacts on the whole of the NHS, even though the focus was on one hospital. They also ask questions about the 6 Cs within interviews, and they want to know that you can demonstrate that you're a caring and compassionate nurse and that you have the ability to challenge behaviour and to improve patient care. Now, the Francis Report was something very significant that affected the National Health Service in 2013, and its implications have been felt ever since. It is called the Francis Report because the person who did the inquiry was called Sir Francis, who was a high-level barrister in the United Kingdom. He was investigating poor care in Mid Staffordshire Hospital between 2005 and 2009, and his final report was published in 2013. He was looking into the hospital to investigate poor care, increased mortality rates, and also lots of complaints from relatives and from patients. The report included interviewing over 250 witnesses and 1 million pages of evidence. The inquiry had been examining the commissioning, supervisory and regulatory bodies in the monitoring of Mid Staffordshire Hospital between 2005 and 2009. It considered why there were such serious problems at the trust, that they weren't identified sooner and weren't acted upon sooner, and they wanted to identify important lessons for patient care in the future. The Francis Report of 2013 builds upon the first report, which was published in 2010, and the inquiry identifies a story of unnecessary suffering of people who were failed by a system which ignored poor care and put corporate self-interests above the care of their patients. The findings of the Francis Report have serious implications for the future of healthcare in the United Kingdom, and in particular in nursing care. The Chairman's recommendations include a list of clear fundamental standards which any patient is expected to identify the basic standards of care, and these standards should be identified in genuine partnership with the patients, the public and healthcare professionals. One of the most significant things of the Francis Report was to cause death or serious harm by a patient by non-compliance of fundamental standards should be a criminal offence. So this means that if a hospital fail a patient on something as simple as hydration or nutrition which has caused harm to the patient or death, then those people involved in the care could be culpable to a criminal offence. We should have a statutory duty to be truthful to our patients where harm has been caused or may have been caused, and there should be an improved support for nurses to deliver compassionate, caring and committed nursing. So this says that entrance to the nursing profession as students or as new nurses to the NHS or to the care home sector should be assessed for their aptitude to deliver and lead proper care. Also, training standards need to be created to ensure that qualified nurses are competent to deliver compassionate care to a consistent standard, and that nurses need a stronger voice so that they should have the courage to be able to speak out openly about things that are wrong within their care provider. Robert Francis said, "We need to ensure fundamental standards are enforceable by law and the criminal of law in most serious cases. Senior managers should be accountable, patients need to be protected from poor nursing standards, and all staff should be empowered to be open and transparent when it comes to the well-being of people in their care. The NHS provides great care, and the system and the people in it should make sure that that happens everywhere." The recommendations he made was that it's not the end, but the beginning of a journey towards a healthier culture in the NHS, where patients are the first and foremost consideration of the system and all those that work in it. It's not just the duty of the individual, but it's also the duty of the organisation as well. To summarise, the report comes off the back of poor care and increased mortality rates within one hospital in the United Kingdom called Mid Staffordshire. Patient care should always be the top of the agenda, and corporate self-interest should not be put before the care of the patient. The focus should be on compassionate healthcare delivery from nurses, doctors and other healthcare professionals, that the system should be transparent and open so that anybody that has a concern about the care within a hospital or a care home should be able to report that care, that there should be good leadership, there should be no tolerance of non-compliance with fundamental standards, that we should involve patients and families in decision making, that we focus very much on risk assessment and care planning, and that the focus should be on the activities of daily living, such as washing, mobility, safety, eating and drinking, and documentation. Off the back of the Francis report, NHS England produced something called the 6 C's. Now, the 6 C's are 6 words which begin with the letter C, and they are very much a focus of interview. So quite often at interview, the questions that they lead with have a focus upon how you as a nurse are able to provide caring, compassionate, considerate nursing. The 6 C's are care, compassion, commitment, courage, competence, and communication. Now, you can find more details on the 6 C's in our educational file. And regarding the interviews, what they want from you in your responses is that you demonstrate that you're a caring, compassionate nurse, that you have the courage to be able to speak out against things that you think might be wrong, or to be open and honest with your patients, that you hold communication in high regard, and that communication is the foundation of good healthcare, that you are committed to providing good quality nursing at all times, and that you're competent to do the job that you're meant to be doing. If you want to find out a little bit more about the 6 C's, you can look at our educational file. And also later on, we're going to do an interview, and you can see the focus of the 6 C's within that interview.